now like to describe and demonstrate a breathing practice called Kapalabhati. It's also referred to as the fire breath by some, although there are other breathing practices that are also called the fire breath. As suggested by the name, it's very stimulating. I consider it to be at a sort of intermediate level, so the general precautions for breath work are a bit more important here. Anyone who has mental illness should consult with their physician before beginning any intensive breath work. And the precautions to maintain a certain number of repetitions and to slowly increase one's capacity is also recommended. I would also recommend that anyone doing this sort of breath regular be in contact with a teacher who is qualified to teach this breathing. However, trying it for a few times is completely safe. In this breath, we make the breath have an active exhalation and a passive inhalation. Normally, there's some amount of force exerted both with exhalation and inhalation, but here we're going to be squeezing all of the air out forcefully and then completely relaxing, allowing the air just to passively flow in. So when doing Kapalabhati, you begin on an exhalation, and ideally you concentrate on your abdomen. Also, we want the diaphragm to be completely relaxed because it's an exhalation, and we want the diaphragm to move up into the chest. So as you're sitting there, you might do it just a few times to experiment, but it looks something like this. So you can see that I have a forceful exhalation, my abdominal muscles are contracting, and then completely relaxing with the inhalation. Again. It's important that your body be comfortable but stable when doing this. Why don't you watch as I do a few repetitions. When you're first learning the practice, it's good to do it a few times, very slowly, and then gradually to increase the speed. You might notice how I'm not using the muscles of my chest, I'm not using my intercostal muscles, or my accessory spinal muscles, or my sternocleidomastoid muscle. All of that's relaxed. The abdominal muscles are doing the majority of the work. In the context of primary care, this Kapalabhati breath would be useful for someone with fatigue, who may be a little bit depressed, someone who has maybe tends towards being overweight, tends to be lethargic or down. It also generally, in the context of other breathing practices, introduces a person to the other half of the autonomic nervous system. Many breathing practices help instill relaxation. This is a breathing practice that helps to stimulate and invigorate the body. So learning those two parts of our physiology, which correspond with the parasympathetic and the sympathetic nervous system, help us to find a certain unity and balance. The dose or the number of repetitions you do with Kapalabhati is critical. It's safe in general to do about 30 repetitions, and you could repeat that twice in one day. If you're doing that regularly, you should seek out the counsel of a competent teacher. And if you feel drawn to do more repetitions than that, again, you should seek the guidance of a competent teacher.